So our back teeth are supposed to be, or all of our upper teeth are supposed to be slightly outside of the lower teeth. So slightly outside. Whenever we have a crossbite, we can have a posterior right or left crossbite. That's whenever the upper teeth on the back are inside the lower teeth. So that's a crossbite there.
I see, yeah. Yeah, okay. I do have that.
And I also had a crossbite on the right side. Sometimes you can have only on one side, sometimes you can have on both sides. You can also have that on the front teeth. That's called an anterior crossbite or an underbite. When the lower teeth, I can't do it with this one, I can do it with this one. The lower teeth go further out than the upper teeth.
Right.
And then it looks like your lower jaw or your lower jaw is way forward. That means that the upper jaw is too far back. So these are jaw issues. They're not necessarily teeth issues. Most of the time, they are jaw issues, of course. That's why with all my patients, I require a CBCT x-ray. So we can send that to get a report and we can really find out together with the orthodontist where is the position of the jaws. Is this a jaw issue or is this a tooth issue? So if it's a jaw issue, skeletal issue, we need a skeletal solution. So we need to increase the size of that jaw. It's not that the teeth are in the wrong place. We need to make the jaw bigger so the teeth can go to where they're supposed to go. Now, if it's only a teeth issue, meaning the jaws are big enough, but the teeth are kind of inclined, then braces, Invisalign, some functional appliances, this is for an adult that I'm talking, can kind of push the teeth out into the bone where they are housed in. It's called the alveolar bone. This bone right here, we can move the teeth within this bone and make the bite a little bit wider and move the teeth where they're supposed to be if it is not a jaw issue. So that's the importance of checking on that 3D x-ray to see, do we need a skeletal solution for this patient or do we need a tooth-borne appliance solution for this patient? Another question that I also ask when I see a crossbite is, do we have any nasal issues? Is your nose usually stuffy whenever you lay down in bed? Is it difficult to breathe through your nose? Whenever, do you have allergies a lot? So those are other issues that we ask. Why am I asking about the nose if we're talking about the jaws? Well, if this was a person and this is the maxilla, that's the roof of the mouth, that's the floor of the nose. It is the same bone.
Yeah.
It's the same exact bone.
My sinuses are right above there.
Exactly.
I mean, they're actually pretty low on my upper one that I had removed that you saw in the picture. That actually took some sinus out of it whenever he pulled it. And I bled for like 10 hours. I went through